folks, we welcome you back to another installment of the OrthoCarolina Medical Minute, here with the head athletic trainer at Belmont Abbey College, Adam Smith. I'm Brian Rushing. Adam, it's now time to talk about some of the individual sports that we're going to cover in the fall. And the first one that I wanted to bring to your attention is soccer. Of course, this is a very pronounced program in regards to history, prestige, the women's team coming off another conference championship. Adam, kind of give me an idea from the athletic training perspective, what it is that you look forward to and expect to see out of the soccer athletes that come in for the upcoming fall.
Yeah, so we're looking for really a lot of lower extremity strength, good core strength. Those are the two most important things that are going to help prevent injuries like ankle sprains and ACL tears. So we're looking for a good, good strength base and good core stability.
Is there anything specifically that would cause you to have an alarm go off, at least mentally for you, from a lower body injury to a particular student athlete that involves themselves in soccer that may not necessarily cause similar alarm for an upper body type issue like a shoulder or an elbow situation?
Sure. So one of the biggest kind of screening tools we can have for especially the women's soccer players is when we look at their jumping and landing, if we notice that their knees are kind of caving inward when they land, even in a controlled setting, like I would ask someone to jump, if we see that their knees are caving in, that's one of the biggest risk factors for ACL tears. So we may identify those individuals and then work with them specifically to help prevent those injuries.
What are some of the more common injuries that you find in the early part of the year when it comes to soccer athletes?
Sure. So a lot of it is ankle sprains, and I don't think there's really much difference in early season versus mid-season versus late season. So we see a lot of ankle sprains, a lot of hip flexor strains, muscle strains when they try to kick a ball too hard too early.
Sure.
And surprisingly enough, a lot of concussions in soccer. They go for a header and they're not quite prepared for the impact or the opposing player coming in and butting heads. That can cause quite a bit of concussions in soccer as well.
Well, thank you, Adam. That's fantastic word there. Some knowledge that anybody that involves themselves in soccer needs to be aware of as the season begins. Folks, for stats, standing stories, and more, there's only one place in cyberspace when it comes to your Crusaders. That place, www.abbeyathletics.com. For the OrthoCarolina Medical Minute, this is Brian Rushing.